Hello everyone, it's Margarita from drregisterednurse.com. I'm so excited about today. I've been trying to do this for a long time. How many of you have struggled with language barriers when taking care of patients? Or as a nursing student, when you go into those clinicals and your nursing instructor goes ahead and assigns you a patient that does not know English and they're Spanish speaking only. The next resort is for you to go get that translator phone, but wouldn't it be nice to be able to communicate and make that personal connection with your patients or with whoever? You might have friends that don't know English and you want to speak to them. So this is such a crucial part of being able to build that rapport with your patients. And as student nurses, I know that it's so difficult for you to make that connection. You're so nervous going in, trying to talk to these patients and trying to have a conversation and make them feel calm and trusting towards you. So don't let language and cultural barriers interfere with your ability to provide high quality care. So here at Dr. Registered Nurse, we will have a series titled Spanish for Healthcare Providers and Nursing Students, because you are there trying to learn and trying to take care of these patients. This series is designed to help you make a personal connection with your patients and their families, which is so important. It's going to facilitate patient orientation. It's going to include nursing assessments for each system. It's going to allow you to assess your patient's comfort levels. How many times do you have to go in there and ask your patient, how is your pain? How do you ask that if you don't know that language? And sometimes, although you have those language phones that they can translate, they might not be available. So it's just a nice, comforting thing to be able to ask them the basic questions. You'll also be able to gather and convey basic information in order to inform the patient and instruct them about any basic procedures. You're going to be able to prepare your patient for discharge. I will help you learn words and phrases that you will find the most relevant and useful for your job as a nurse and as a nursing student, or even a certified nursing assistant, a physician, a doctor, doesn't matter who it is. If you are dealing with patients, it's so important to be able to build that relationship with them while you are taking care of them. This week in particular, we're going to start by learning those common words, greetings, and farewell. So please stay tuned. So let's get started with Spanish for healthcare providers. Today we're going to learn common words. In Spanish, you say palabras comunes. So these are words that you use every day when you're at work, when you're taking care of patients. For example, the word you, we use that a lot. In Spanish, you translate that to usted. Usted is a formal way of saying it. For example, if the person is 18 years old and over, you use the word usted for formality. When you're taking care of patients, this is the word that you want to use when you want to say you in Spanish. If it's someone that's under the age of 18, I'm going to go over that word in a little bit, but it's tú. So that's the informal version. So again, the word you is usted. The next word we're going to learn is the words I or me. They are the same thing in Spanish. You say yo. So for example, if I want to say, I am going to take care of you today, I'm going to say, yo lo voy a cuidar hoy. Yo lo voy a atender hoy. Because yo is the same as I or me. So remember yo like yo-yo. The next word we're going to go over is I am. One thing that you'll notice about this is that those two words turn into one word in Spanish. So the words I am, for example, I am Margarita, is soy Margarita. So like soybeans, so the words I am turn into soy in Spanish, one word. And you're going to notice that a lot in Spanish, that certain words in English that you need more than one to say turn into one in Spanish. So it makes it more condensed. The next word we're going to learn is my. In Spanish is me. Like if you were to say me for me, is me. I for is the Latin I. So my is me, for example. When will you use that? If I wanted to say mi nombre es, my name is, I say mi nombre es Margarita. My name is Margarita. So you'll notice that what I'm trying to teach you is those common words that eventually you're going to start putting them together into full sentences, okay? Now the next word we're going to learn is he or she. So those words in Spanish are él or ella. So what's the difference? As you see, he is él for male. she is ella for female. So you will see that the letter E has an accent on top. That means that you need to put emphasis on that letter. In the Spanish language, this is commonly used. Now, for this series, we're not going to be dealing with accents and specifically grammar. We're going to just show you how to translate those common things that you're going to deal with on your regular day basis at work. So the word él for he has an emphasis on the E. So you say él, and then for ella is ella. That one, there is no emphasis. But just know that when you see a little accent on top of a letter, give it a little more oomph, because that is what it's meant to sound like. The next one is of. So that is translated de. Of, which is O-F, de. Now we're going to do the word now. That is translated into ahora. The H is silent, so if you want, pretend that that is not even there and just go straight through the O. Ahora. That is now. The next word we're going to go is where. So the word where is translated into Spanish, donde. For example, where are you? ¿Dónde tú estás? ¿Dónde está usted? Which means, where are you? I said it both in informal of tú, which you're going to learn in a minute, and usted for the formality, like we reviewed in the beginning, for you, when it's talking to an adult, an authority figure. So the word where is donde. So the next word we're going to learn is what. So the word what is translated into que. Que. If you think about it, it sounds like K, but you have to add that UE, which is different in the Spanish language than the English. You don't have that as part of your alphabet, but in the Spanish language you do. So the word what is que. Then you have the word have. So that is translated into tiene. Do you have pain? ¿Usted tiene dolor? Tiene. So that's when you would use it. And again, I'm just showing you the common words right now, but we're going to start putting them into more sentences in the next slide and also in the coming weeks, okay? So the word have is tiene. Then you have the word is, and that's translated into es. So is, just take the I out, and is es. For example, mi nombre es, my name is Margarita. Mi nombre es Margarita. So that is in English, but is in Spanish. So the next word is your. So that's translated into different things depending on what you're trying to say. So the word usted is here again. Then tú, which is the informal that we talked about earlier, in su. For example, ¿cuál es su dolor? What is your pain? Su, S-U. That's when you would use that. Or you could say, ¿Usted tiene dolor? Do you have pain? So you can combine different words. So make sure you keep this slide someplace safe. You can take a picture of it right now. This video is going to be in this channel, Dr. Registered Nurse, so you can come back and refer to it. The best tip I can give you is to take a picture of this slide, laminate it, and have it with you like a badge buddy, because that way you can always have it with you and you can start putting things together. So I have one more that I want to show you. I will be. So now we're starting to combine some words. So this is translated into Spanish by seré. So look at that. You have three words that went to Spanish to one word. So combined, it makes seré. Look at the accent on the E, so there's more emphasis on that last letter. So I will be seré. For example, I will be your nurse today. Yo seré su enfermera hoy. Yo seré for I will be, su for you or your enfermera hoy. That means nurse today. So that is how you start learning, start combining, start trying to make your own sentences, okay? So again, I will be goes to seré. Yo seré, which means I will be or will be, your, su, enfermera, nurse today. Hoy, and you're going to learn that right now. So we're going to be going through greetings and farewells. So saludos y despedidas. That's how you translate that. And here we have the first one. the most common one, hi or hello. I bet you know this one. Hola. That is exactly right. Now the next ones that we're going to go over is good morning, good afternoon, and good night. So let's put them all together. Good is the same all throughout. The only thing that changes is that it becomes from OS to AS. So it makes it a little bit feminine. That's what they call it. Not that necessarily the patient is feminine. It's just the word turns into a feminine word. So good morning is buenos días. Good afternoon, buenas tardes. Good night, buenas noches. So as you see, again, the first word for all three are the same, with the exception that it turns into AS for both good afternoon and good night. So let's do that over. For good morning is buenos días. Remember that emphasis on that I, there's that accent. Good afternoon, buenas tardes. Good night, buenas noches. Then we have goodbye, and we're going to do sir or ma'am. Sir is for male, ma'am is for female. So the way you would say that is adios. Look at the emphasis in the O. Adios, señor. That's for male. Adios, señora. That's for female. They add the A at the end. So let's do that again. Goodbye, sir or ma'am is translated into adios, señor. Adios, señora. So if you were to take some of the words that are already here in this slide, we can combine something. For example, the word hello, we can say hola, señor, hola, señora. When you look at this slide, you can combine some words. For example, we have the word hola, which is hello or hi. We have señor, which is male for sir. And we have señora, which is female for ma'am. So let's see. If I wanted to say, hola, señor. Hola, señora. Buenos días, señor. Buenos días, señora. Hola. And then if you were to take words from the other slide and combine them, you'll have so many other phrases that they can do. Okay, so remember, hi or hello is hola. Good morning, good afternoon, and good night are buenos días, buenas tardes, buenas noches. And goodbye, sir and ma'am, is adios, señor, y adios, señora. So the next word is miss. So this is a little different, and you'll notice it has a little bit of a difference at the end. So you see how in the previous one it said adios, señor, adios, señora. And now it says señorita for miss. So when someone is not married, or they are not old enough, or they're not an adult, you're going to say señorita. Okay? But if they are older, if they're an adult, or they are married, they go into the señor or señora. So señorita is for a girl that's under the age of 18. And anything above that, you're going to go to señor or señora if they are married. If they are unmarried, they are still called señorita. So miss is señorita. Sir is señor. Ma'am is señora. The next one is hi, sir or ma'am. So how do you think you're going to combine that? Hola, señor. Hola, señora. And you see how you're starting to put things together. And that's the key to learning Spanish. Then we have my name is. Now you know from the previous slide how to say part of this. My, remember, me. And how do you say name? Well, you can say mi nombre es, but shorten that and say me llamo Margarita. Remember that I told you that there are words in Spanish that you can combine, that you don't have to say multiple words at a time. So yes, I can say mi nombre es, which I'm sure you know. Mi nombre es Margarita. My name is Margarita. But you can also say me llamo Margarita. And that will cut down on the words, and then it's easier for you to pronounce, and it's easier for you to remember. Now we have what is your name? Now we've reviewed some of these words already, so let's see. ¿Cuál es su nombre? So when you're doing that assessment, when you're trying to check if your patients are learn-oriented ×3, and you're going to ask them, what is your name, in order to see if they know who they are, and that's part of that assessment, you're going to say, ¿cuál, what, is, su, your name is nombre. Now remember, we just talked that my name is can be also condensed to me llamo. But when you're asking them the question, you cannot use llamo. that is for you when you're referring to yourself. So what is your name is translated into ¿Cuál es su nombre? So let's see. I'm going to combine some things that I see here on this slide. So I'm going to pretend I'm going to a patient's room, and I'm going to say, and it's 9 in the morning, and I'm going to say, Buenos días, señor. Yo me llamo Margarita. ¿Cuál es su nombre? And the patient is going to say, Yo me llamo Carlos, or yo me llamo Marta, or yo me llamo Berenice. So that is what you're going to get in response. So this is also another slide that you should print out, take a picture, whatever you want, come back to the video and review it, and put it in your badge, like a badge buddy. Laminate it, because you can start combining so many words. Okay, so I want you to do that. Now, next week, we're going to do a couple of things. We are going to continue these introductions. For example, we're going to get more into detail about I'm the nurse, Dr. Abe, those specific introductions. We're also going to review some courtesy phrases. For example, how are you feeling today? So we're going to get into those, and I will review what we did this week and then start introducing more. I want to make sure that you know the basics first, because you don't want to just jump to trying to learn the pain assessment and the respiratory assessment and the neuro assessment if you don't know how to actually start a conversation with your patient. So make sure you tune in next week, because we are going to continue these introductions, and we're going to introduce some of these courtesy questions that we deal with every single day when we are at work. Well, I hope that this video was of great use to you. It sure was for me. It was a great review for myself. Make sure that you watch the other videos in Dr. Registered Nurse in this channel. Please leave your comments down below. Don't forget to subscribe to the channel, like this video, and share with your friends and family. And I hope that you really enjoyed it. Put down any questions that you have, and I will answer them like I've been. And I look forward to our next chapter in this beautiful Spanish for Healthcare Providers. Bye.